6-year-old Andrew Curtis of Warren, Michigan, had just started kindergarten when his mother Sherry noticed his stomach was unusually swollen and hard. So she took him to a local urgent care center where the doctor gave her some news she wasn't expecting.
She looked at me, took me out of the room actually, and said, there's something that I'm finding. I don't know if it's a blockage, I don't know what it is, but you need to go right now to the hospital. And I looked at her and I said, children's.
From there, things progressed very quickly. Andrew was diagnosed with a rare and aggressive form of cancer called desmoplastic small round cell tumor, or DSRCT. DSRCT causes multiple, often hundreds of tumors in the abdominal and pelvic area and predominantly strikes adolescents and young adults. His family was devastated by the news, but had faith that Andrew could fight it.
He's our little Iron Man. If anybody's going to beat this monster inside him, it'll be him.
Within days of his diagnosis, Andrew and his parents met with pediatric hematologist and oncologist Dr. Joanne Wong.
By the time I met him, we also knew his cancer had spread to his liver, to his spleen, to his chest. So we had similar patients in the past, so I knew it's going to be a challenging case.
Dr. Wong began chemotherapy immediately to shrink the main tumor in Andrew's pelvis. She also discussed Andrew's case with more than 30 physicians on the Children's Hospital of Michigan's Multidisciplinary Pediatric Tumor Board. They decided to reach out to Dr. Andrea Hayes Jordan, a pediatric surgeon at MD Anderson Cancer Center in Houston, Texas. Dr. Hayes Jordan is the first surgeon in the country to perform a procedure called HIPEC for children with DSRCT. This method uses a combination of surgery and heated chemotherapy. Dr. Jeffrey Taub, chief of oncology, has referred other patients to Dr. Hayes Jordan in the past.
When we provide care for patients, we always try to see what is the best for the patient. And I don't think we have any sort of boundaries or barriers. This surgery is essential to try to cure them, and especially in Andrew's case, removing hundreds of small little tumors from within his abdomen.
Knowing that time was of the essence, Sherry and Andrew got on a plane to Texas to meet with Dr. Hayes Jordan.
As soon as I met her, she said, I want to help your son, and I'll even come to Michigan. So it was amazing. When you have that many doctors now trying to work together and coordinate to give my son this big chance at life, it was the best news ever.
Is Andrew in here? Hey, Andrew. How are you, buddy?
Children's Hospital of Michigan pediatric surgeon Dr. Justin Klein teamed up with Dr. Hayes Jordan to perform the surgery on Andrew with the goal of learning the technique so other children in the region can be helped in the future. Andrew was the first pediatric patient in Michigan to benefit from this cutting-edge procedure.
The survival rate for this cancer without any surgery will be 0. With surgery, approaches 50% in best hands, and with the addition of chemotherapy, has been up to 70%. We removed over 400 nodules from Andrew's abdomen, including the largest from his pelvis, where it was apparent that the initial tumor had started really growing. So the heated chemotherapy has shown that the combination of the heat as well as the chemotherapy delivered directly to the abdomen instead of intravenously results in 10 to 30-fold times of higher concentration that can be delivered. This higher concentration is delivered with less side effects than if it was systemic, and the synergy of being heated with that high concentration is what helps remove or treat the residual microscopic disease that we may not pick up at the time of surgery.
After surgery, Andrew went through more chemotherapy and 20 rounds of radiation.
Hold nice and still for us.
Despite some fatigue now and then, this remarkable boy hasn't let cancer slow him down. He's too busy planning for his future.
You firefighter, doctor, even joined the army, even police. There's so many things to do. When I go to the hospital, the first thing I like to do is give hugs.
He's such a cute boy, and he's very smart, and he's very articulate. I would say I'm cautiously optimistic. He had very widespread stage 4 disease, but he had very response to his treatment.
Andrew is distinctly a fighter and survivor. He's gone through more at the age of 6 than most people, and he's done very well.
Well, congratulations, Andrew. We got you through. We got you done with all this, so it's time to celebrate. So why don't you go ahead and ring the bell, and we'll let everybody know you're done.
I rang the radiation bell. Something's good.
I owe it all to the doctors.
Thank you.
Really super good, like a superhero.
Dr. Wong and Dr. Klein and the whole oncology staff at Children's.
Because I'm done.
See you next time.
My body isn't hurting anymore.